face tomorrow.
All right.
These are all your medical forms. So just go through and fill all these out, okay?
Okay.
The last one. And then these are the papers for the consent to the procedure. So read them over and sign them. If you have any questions, you can wait and ask the doctor. Okay?
Thank you very much.
You're welcome.
Good morning, Mr.
Good morning.
Fazemeyer. Dr. Bowles will be with you in a few minutes.
Nice to meet you.
Good to see you. Kathy Smith.
What I'm filling out here now is a medical history form. Now it's asking me if I have any allergic reactions to xylocaine, which is a numbing agent. I do know that. It's, once again, a yes-no answer. Okay. What I have here now is just a consent form that New Hart does give me to read and fill out, so I give consent for the doctor to do the surgery. So I'm just going to kind of go over the general information, and then I'll sign it at the end if I'm very happy with what I see here. So I'll read it over. Okay. Here you are. All finished.
Okay. All right, just have a seat, and they'll be up for you shortly, okay?
Thank you very much.
Thanks. Hi, Bob.
Hello.
I'm Jennifer.
Nice to meet you.
Nice to meet you. You ready?
I guess.
Come on back. So just be a little saline.
All right.
One more face shot. And the rest of the hair. Then have you come up and sit in the gray chair?
All right.
Put your feet up, make you feel a little more comfortable. Tilt you up a little. Okay, can I get you something to drink?
I can have some water, please.
Water? Sure, I'll be right back, and
All
I'll
right.
let the doctor know that you're ready.
Okay, thank you.
You're welcome.
Good morning, Bob.
Morning, Dr. Bowles. Good to see you.
Good to see you again. So you decided to come back, and that's a good thing.
Yeah.
You know, Bob, we did your first session several years ago. Now, this is your third session, is that correct?
Right.
Okay. As I recall, after the last session, one of the things we talked about doing was to come in here at a certain point in time and just to add just a little fill-in. Is that correct?
Right, right.
Let me ask you, having had two sessions, are you pleased with things? What are your thoughts?
Very pleased. Before I did my first session, my hair moves were two. One down, one over.
Right, right.
So after the growth of the first session, I started to have a little bit more length. So I started styling it like I do now.
Right.
The second one gave me a little more volume. Now I'm here just to create, enough volume and not have to do any more.
Sure.
That's what I'm looking to do.
Review with me. Any current or medical problems?
Not really. I still take Crestor for cholesterol.
Okay.
And that's about it. I do take some aspirin on a daily basis,
Okay.
just a precautionary thing, but I haven't taken it in a couple weeks, which, that's what it said in your pre-op instructions. So
Okay.
I did stop taking it. So, I pretty much know, being here before, what I have to do to prepare myself.
Good.
And,
But you read and you followed
yeah,
directions.
and I'm ready to go. So
Excellent,
that's-
excellent. Well, let's start off by doing this. One of the first things I always like to ask the patient is what you want. I'll always tell you what I think, but keep in mind that hair transplants is a situation of not just medical, but also artistic. So it's a blend of medicine and art. Mm-hmm. And as I walk in the door, I certainly am not going to tell you what I think is going to take to make you happy. I want you to tell me what you want, and then we'll go from there. Okay? So let me grab a mirror, and that's for you. One of the things that I also do, Bob, and you remember, is that we always like to mark off where we're going to work. So again, it's you telling me telling you. We work as a team, and hopefully, that team effort gives us the result we want.
Right.
Okay? So what do you want?
Well, I know right here in the front, I need to thicken that up a little bit. I mean, I've got pretty decent volume there, but, a little bit more volume wouldn't hurt.
Sure.
Just on the hairline in the corners, maybe
Okay.
just to thicken it up. I'm not looking to bring the hairline down any further. I'm satisfied. I know it looks natural. and that's the way it's supposed to look. But like in the top here, maybe just thicken it up some more.
So I always like to tell patients after we're done or sometime during their session what I think the future holds for them. Are you going to continue to lose more hair? Will you do more work? Yeah. But many times people will come back, not because they have to, but they come back because they want to.